Welcome to Pharmacy View Podcast, where we provide regular interviews with pharmacists and key people within Australian pharmacy and the associated global industry. In this stream of podcast episodes titled RX to Riches, we delve into the evolving global pharmacy landscape, exploring the challenges and opportunities, and examining the current state of retail pharmacy across the globe. With each guest, we discuss the hurdles they face and the potential growth areas that may shape a brighter future for your pharmacy or industry-related business. I'm your host, Michael Alexander, pharmacist, digital health enthusiast, and co-founder of Audirie, an AI-powered communication intelligence platform serving the healthcare industry across the globe. My guest today is proudly brought to you by Shopfront Solutions for all your shelf and digital marketing needs, part of the Arion Technologies Group.
I think we've still got a way to go because there are definitely programs where maybe there's some short-sighted or not a broad range of thinking with pharmacists working in community pharmacy, thinking that particular programs might cost them too much to implement or not be worthwhile. And I think not having that sort of really deep understanding of building that customer relationship and the value of a lifelong customer. An example I know I've spoken to AP about in an article around wound care is setting up a wound service. So I know that's an expensive service. It's expensive in materials and it's expensive in pharmacist time. But if you've got that really close relationship and contact with the patient and they're coming back into your store to get wound treatments, you're building a rapport and a relationship with that customer that far exceeds the value of whatever profit you may or may not be making from that service. So I think there are still pharmacists out there who need to have that broader business thinking and really value that lifelong customer value.
Welcome to the RX to Riches podcast, part of the Pharmacy View family of podcasts. Today, I'm excited to welcome Kerri Barwick, the General Manager of Education and Training at the Pharmaceutical Society of Australia. With over 6 years at the PSA, Kerri has spearheaded the design and delivery of evidence-based training programs for pharmacists nationwide. Her career began in community pharmacy, getting hands-on experience, followed by roles in marketing and business after earning a business degree. Returning to the PSA as a training officer, Kerri combined her pharmacy and business expertise to create innovative training solutions, driven by her passion for empowering pharmacists and advancing the profession. Welcome, Kerri.
Hello, and thank you for not saying what year I started in pharmacy. That was very kind of you.
Well, then I have to say what year I started, and we don't want to get to any of that. So, but we've both been in the industry for a little while. Let's say a little while.
Yes.
But I'd love to hear more about your professional background and what led you to your current role as General Manager of Education and Training at the PSA.
It's been quite an interesting journey. So for me, I started in pharmacy in high school as a casual pharmacy assistant. And I was really lucky to work in a really great pharmacy. It was a Don Gardner pharmacy in Queensland. And it was a nice place to be a baby in the pharmacy world. And I did that for a few years until I finished school. And when I finished school, thought that firstly, I didn't quite get the grades that you needed at that time to get into pharmacy. And also thought I might get bored with being a pharmacist. So I decided to study business and majored in marketing and management and tried out a few different things. But throughout my time studying and moving around different cities to Australia, I kept getting dragged back into pharmacy land. And so I did quite a few different roles, buying, merchandising, things like that, and managing retail, front shop manager for retail pharmacy. And after I'd had 3 kids, I was working as a casual pharmacy assistant in a pharmacy in Sydney, and the pharmacist casually said to me, "Why are you not a pharmacist? You'd be quite good at that." And I thought, well, I probably could do that. And honestly, on a whim, applied to do pharmacy. And I was really lucky to be able to study through UNE distance education and just do some bulk times at res school. So with a young family, it was maybe not the smartest thing to decide to study with a 2, 4 and 6-year-old at the time, but I got through it. And I'm really glad I did. It's been a really great addition for me to be able to, like you said, combine that business and other side of my training and experience with my pharmacy side of my experience. And really, I just came to the realisation I was never going to leave the pharmacy industry, so it's about time I may as well just be a pharmacist. So worked as a pharmacist for a short period of time, and then, came to the PSA as a trainer assessor and have worked my way through to the GM role. So it's, it's been a very rapid progression for me, but I've enjoyed every minute of it.
Well, it's interesting because you actually did the opposite of what a lot of pharmacists do, me included, where I started off in pharmacy, went into sort of the business and management side, and then realized, wait a minute, I don't know anything about business or management, and then went and kind of did a business degree. But you started off doing a business degree and then went into pharmacy. So how do you think that impacted the way you saw the profession, how you, progressed through the profession? Do you feel there was an impact? Did you think differently than other pharmacists?
Yeah, I think so. I know that it's a little bit different now, I suppose, to when I first started in pharmacy, with the really strong influence of banner groups, and that pharmacists who choose to be part of groups really get a lot of support through marketing, business management, and that side of things. Because my belief is that pharmacists are scientists and we're very good at that, but we're not necessarily very good at running a business or running a retail business, and no one ever teaches us those skills directly. So I think having that experience, I did see things a little bit differently to other pharmacists, and it just gave me a different perspective. But I think a lot of pharmacists are quite lucky now to be part of those groups that are giving them that support without having to do as much of the work in the management and business side of things.
Yeah, it's a really good point, because when I went through my pharmacy degree back, in the Stone Age, the only real big banner group in Queensland, because I went to the University of Queensland, was Terry White. Yeah. So they were kind of seen as the model in terms of business acumen, but there wasn't a ton of Terry Whites, a lot of opportunity to go in and work for them. So most people went into, either from my class, either went into hospital pharmacy, which was seen as the more prestigious pharmacy in a sense, or stream of pharmacy, and then or just your general small pharmacy, mom and pop stores, or the small banner groups. So I think the business acumen at that time was not nearly where it is now, where pharmacy students are now graduating, having exposed to all these different types of banner groups, and going in really and learning a lot of that business acumen pretty much right at the very beginning, versus years and years of trying to get through the industry and understanding business. Would that be fair?
Yeah, I certainly agree with that. But I think we've still got a way to go, because there are definitely programs where maybe there's some short-sighted or not a broad range of thinking with pharmacists working in community pharmacy, thinking that particular programs might cost them too much to implement or not be worthwhile. And I think not having that sort of really deep understanding of building that customer relationship and the value of a lifelong customer. An example I know of, spoken to AP about in an article around wound care, is setting up a wound service. So I know that's an expensive service. It's expensive in materials and it's expensive in pharmacist time. But if you've got that really close relationship and contact with the patient, and they're coming back into your store to get wound treatments, you're building a rapport and a relationship with that customer that far exceeds the value of whatever profit you may or may not be making from that service. So I think there are still pharmacists out there who need to have that broader business thinking and really value that lifelong customer value.
Absolutely. I think, again, if you take care of the customer, the business should take care of itself. It's an old truism, but it's just as true now as it was, back when we were going through.
Yeah, it's really easy to lose sight of that with a lot of the policy and the hurdles and things that community pharmacists do come up against. So I'm not trying to downplay that perspective, but I really think that in terms of professional services, we need to take every opportunity we can and build that as part of our businesses.
Well, that circles back around to my next question, which is some of your key responsibilities and initiatives that you oversee in your role at the PSA. So what does a general manager of education and training actually do?
Other than meetings all day, a lot of team meetings, but my responsibility area is quite broad. So I'm very lucky to have fantastic managers who work with me to achieve what we need to achieve. I most certainly could not do it by myself. So the different areas we cover are conferences. So PSA 24 coming up in early August, our state-based conferences, the annual therapeutic updates, as well as our consultant pharmacist conference. Other smaller events, so all our intern workshops and mental health first aid workshops, immunisation workshops and things like that. So all of those events are under my umbrella. I've got a team who manage the RTO side of things. So they're the community pharmacy assistant qualifications, Certificate 3 community pharmacy. We have Diploma of Leadership Management, Graduate Diploma of Advanced Pharmacist Practice, so all of those RTO products. Got a team who look after the CPD. So most of the CPD products that the PSA deliver sit under my banner as well. And then the new area of the credentials, so MMR and ACOP credentials, and soon to be pharmacist prescribing. So I feel like I've missed some, plus the learner support for that, all the trainers, assessors to deliver those products. So it's quite a large team. It's very busy, and but I enjoy it. We have a lot to achieve, but I'm very lucky. My managers help us do everything we need to do.
It's a lot, Kerri. How do you have time for meetings is my question, my follow-up question to that. That's a lot.
It is.
Responsibilities.
Well, those relationships and dealing with people is, a really large part of the job, and making those connections. In a typical day, I'd have meetings with partners or universities, my managers, other GMs, the CEO. So that's all a really important part of the role, but it is hard to then manage the other deliverables on top of that.
Well, there's really some really exciting things coming down the pipe, and you mentioned, for example, pharmacist prescribing. Obviously, that's going to be a huge initiative through the PSA. But I wanted to talk a little bit first about the challenges. What challenges do you see pharmacists, interns, pharmacy assistants facing today, right? And how does the PSA address those challenges through their training programs?
Yeah, it's no secret that I think one of the biggest challenges is time constraints. So pharmacists are continuously being asked to do more, and there are sometimes in particularly in rural and remote communities, there's challenges in finding pharmacists or pharmacy staff. So that time component is most certainly something that we're well aware of. I know there are more graduates and pharmacists coming from overseas and interns coming through at the moment, but it's a while before that results in a qualified, competent, experienced pharmacist to take on those sort of expanded roles. When you take aged care into it, that's adding to that sort of burden of the workforce. It's not an easy problem to solve. So the PSA, I think, in developing our training, are really aware that it needs to be flexible. That's probably one of our primary focuses in how we deliver and develop our training, is that not many pharmacists would be able to take time off work to be able to undertake the training and assessment they need to deliver these types of programs. So there are some exceptions where you can't do it all online, or you can't do it all by distance, but as much as we can and where we can, we really aim for learners to be able to do the learning wherever and whenever they need to be able to do it, because we do understand the time constraints that pharmacists and pharmacy staff are under.
Just had a thought about, you mentioned a shortage of pharmacists, and, overseas pharmacists kind of trying to make up part of that shortage. Now that has been a story since I started in pharmacy. And one of the things that I can do with this podcast is I speak to pharmacists all over the world, in the US, UK, for example, and everybody seems to be facing the same shortage, no matter
That's right.
where they are. Why do you think that is? I have a theory myself, but why is there always a chronic shortage of pharmacists? I want to hear your theory first, and then I'll say
Okay.
mine.
I think it's multifaceted. One of the problems is that we need more pharmacists. So if you go back, say, 10 years, pharmacists were not immunising. Pharmacists were not, I won't say not prescribing because that's a hot debate, but pharmacists were not necessarily having the authority to prescribe the medicines that in some states we do now. There were not pharmacists necessarily working in GP practices in aged care facilities. So there is a need for more pharmacists is problem or reason number one. Reason number two is I think this is starting to change, which makes me really happy, but it's really not necessarily perceived to be a sought after position. That it's a really hard job, and I only have experience in community, so I can't speak for hospital pharmacy, but I don't see it would be any different. You start the day and you are under the pump, under pressure the entire day. You don't really get downtime. And I think because most of us in our profession we're in it because it's a caring profession and we care about our patients, that you don't want to leave people waiting. You don't want to let people down. You don't want them to go without their prescription. So you've got a constant struggle to keep the customer happy, keep the patient happy, and a really high burden on the clinical skills that you need to do, so that people don't want to wait for their prescription, but you want to make sure you're not going to make a mistake and that it's the appropriate medication and you've done the appropriate checks and balances and everything. So it's a really, really demanding role. And we're not often given the credibility and the accolades that we deserve for the job that we do. Just put a sticker on the box. It's the most infuriating comment I think a pharmacist can hear. So, but I do think that's changing. That's a really positive change in our industry. And I hate to say COVID, but I think it was the catalyst for that. People really started to realise that, or it came to the forefront, that pharmacists could do a lot more than we have been given the authority to do in the past. And that really came to light through COVID. But you hear people say all the time, I check with my pharmacist first before I go to the doctor. We're trusted. The general community really believe in our advice and in our knowledge. So, but it isn't always respected. And I think that's a really hard thing to do day in and day out, where you've got those pressures, but you're not feeling like you're necessarily respected for that role. So there is that element of people leaving our industry, unfortunately, and doing other things. So that, coupled with a higher demand, obviously there's going to be a deficit.
I think you've hit the nail right on the head, and I'll add a couple of things to that. So you're right. We really have a unique vocation because we are under constant time pressure. We have to deal with people all the time, and we can't make any mistakes.
Yeah.
Especially in the retail environment. It has to be an error-free, totally error-free environment.
Yeah. While
you have seconds sometimes to make decisions on medications or diagnoses, is very unique. You can't really think of any other profession that has to deal with all those pressures at once. I have a friend, and I think I've said this before, who's an air traffic controller, and we have a lot of common ground when we talk about our jobs, because it's a similar type of thing. No air environment, time pressure, constantly having to organize things in real time, troubleshoot in real time, no margin for error. So I think all of that contributes. But I think the main thing in my mind is, and I think you touched on this as well, is pharmacists feel like they're undervalued because they can't really perform at the top of their license, right? They don't have a lot of ability because of the time pressures, because of lots of other factors, to feel like, I'm really using all of my skill sets.
Exactly, yeah.
And I know in order, for my patients.
When I was, first finish uni and you learn so much about different health conditions, first line treatment, second line treatment, all of that information that we're given. And then you get out into the real world. And like you said, it's really hard to use that knowledge. And that feels it's a real letdown, because you finish uni and you finish your intern program and then you think, well, I'm not using this knowledge, and I have got, we are the medicines experts. And I think that it's an exciting time in our profession that finally, I think we're being given through different pilots and trials the authority to use that knowledge and use our skills to the fullest extent, and and work to our full scope.
Yeah, it's really exciting. But to your point, the only way we can do that is to be able to train pharmacy professionals. And that's one of the challenges, is trying to train them in this environment where they're dispensing many, many prescriptions and serving customers and doing all these other things. How do we then deliver that training in order to have these professionals?
You get to the end of the day and you don't want to sit at the computer and do more study. And I think it's particularly difficult when there's been, I suppose, a debate in the industry and around our industry about what training do we need? Do we already have the competencies needed to prescribe? And if you consider giving an immunisation or giving an over-the-counter medicine, we're communicating with the patient, we're making a decision based on the information they're giving us, and we're recommending a medicine for that. How is that not prescribing? I perceive that to be prescribing. I understand the difference with scheduled medicines and all of that. So then there's a grey area and a question around, well, what level of training is needed for pharmacists to be able to do prescribing as in the prescribing and part of these trials and pilots. So I think the easiest place to start to look at that is the competency framework for prescribing. And when you match that against pharmacist competency, the competencies for pharmacists, there's not very many gaps. So really, that's what we're training against. And then you have those core skills and you decide what your scope of practice is. And if there's a gap there and you need to do some clinical updates or a refresher on that clinical training, then that's the gap that you're required to fill as your own professional judgment and CPD and your responsibility as a pharmacist. So I think that's probably one extreme. The other extreme is the thought, probably more outside our industry, that pharmacists should have to do years and years more training to be able to prescribe, because that's what some of our colleagues in other professions have had to do. So it's been quite difficult in finding the right place for our training, having those two extreme views in our world. And then I suppose it's made easier by having the performance outcomes and the guidelines given by the Australian Pharmacy Council, because this is what we have to meet and it's pretty clear. So, yeah, but it has not been easy. And we're not quite there yet, so, yeah.
Well, I think we both, we're both pharmacists, so I think we could both agree that that gap or that delta is much smaller than I think many people think, because of all the training, much of which sometimes we just aren't able to demonstrate in the retail environment, but that is changing. And so there's there's now this really exciting, these exciting new ways we can use our license, including prescribing, but there is some training that needs to be delivered. I want to talk a little bit about how you're delivering that training, because you've recently launched an AI-powered training simulation platform. That was part one of my two-part podcast with Kerri Barwick. Tune in next week for some more interesting insights. I'll see you there. Thanks for joining us today on the Pharmacy View podcast. And don't forget to like, share, and leave a comment if you found this episode of value or have any feedback. Podcast episodes are promoted through social media, LinkedIn, YouTube, and major podcast mediums. And each episode can be found on the Pharmacy View webpage with links to guest contact and business details. If you're a pharmacist or industry support supplier and would like to join us on an episode, send us a message through LinkedIn or complete the inquiry form on the Pharmacy View webpage. I'm your host, Michael Alexander, pharmacist and co-founder of the communication intelligence platform Audirie. On behalf of Shopfront Solutions and Arion Technologies, thanks again for joining us today on the Pharmacy Viewed podcast.